You to three ladies who have all been under care here in the office. Two of them have been under care for a couple of years and have been wearing their brace during that time. The other one has been under care for a few months and has been wearing her brace only for a couple of weeks. But keep in mind that all three of them are also performing scoliosis-specific exercises and have also been through therapy here in the office, just to give you a total perspective about what you're about to listen to. With no further ado, let me introduce you to three wonderful ladies. First of all, tell me, what is the curve size that you had when you first got here?
I believe it was 81 on the top and 65 or 67 on the bottom.
Good. And you've had treatment here for how long?
That'll be 2 years in August.
Good. And tell me a little bit about your experience. Just give me like a 30-second.
Sorry, I was searching for. I was having a lot of pain. I'm having scoliosis my whole life. I was diagnosed in high school, and I was searching for help because I've been on and off to chiropractors, yoga, even yoga for scoliosis, which was helpful. It was all helpful, but no one ever evaluated me overall and evaluated my health. There wasn't this holistic approach to, my lifestyle and everything going on, and that's made all the difference. I mean, there's a lot of components. It's a lot of commitment.
Tell me about your brace wear. Like how many hours are you wearing?
I wear it from, if I have something going on, sometimes a little less, but usually 5 to 7 hours a night in the evening when I get home from work.
Mm-hmm. But you're not sleeping in the brace?
No, I haven't. I'm not terribly comfortable.
Right.
Like I'm comfortable doing the things I do. I haven't done a lot in it. I can take a walk. I take a walk. I wash the dishes. I do some things around the house. I relax.
Right.
And, relax laying down when I come home for a while and then do some things. And it's my kind of later time in the evening when I'm tired anyway.
Yeah. And what about your pain? Yeah. Tell me about the pain before and after getting the brace.
I've had almost no pain the last 2 years. I rarely stop and say I have pain.
And before that, before you had the brace?
Every day.
Yeah.
Every day.
So it really gave you back a sort of.
It's kind of like dull, constant pain because you're used to it.
Yeah.
But what drove me to find you and seek you out is that last year I was not just having pain, like I was walking somewhere with my son and I could barely make it down the street. I was holding my back. I felt like I was holding my back in, and when I went home, I felt like I couldn't hold my head up, just sitting. I was just really, weak and tired and pain.
And now?
I do everything.
Beautiful, beautiful.
Yeah.
And Colleen, tell me, let's just have a little rehash on you. So first of all, tell us your curve size.
It was 75, I think.
75, and how long have you been using the brace?
Almost 2 years.
Yeah.
I think it'll be 2 years in October.
And tell me what your experience has been before and after getting the brace.
I had scoliosis since I was a teenager, and I would do everything I could, but I had been hospitalized. I had several herniated discs. I couldn't walk when I was pregnant. Things like that, and it just got really worse a couple of years before I finally found you. And this is, instead of the surgery, which I didn't want, this has been real positive. I wear mine 24 hours a day, pretty much. I can work in it now. I've always been a hiker. I've always been real active. I canoe, and I couldn't do those things the past year before I came here, and now I can do those things again.
Beautiful. And you said you just hiked a peak, right? Didn't you tell me that?
Yeah, I hike just a couple times a week now, and I just did another high peak. I've done, I don't know if you know the 46 in New York.
Yeah.
It's all the peaks over. I've done them several times, and I pretty much had to stop, but I got back out there and did a couple of high peaks last week.
Beautiful, beautiful. So what's your pain levels like now?
If I have my brace on, I don't feel pain. Sometimes I can feel discomfort if I'm, but I have a backpack on or something's pushing it on, but I'm not in pain.
And tell me about your sleeping pattern before you had the brace and after the brace.
I could hardly sleep. I could, just because of the pain. I couldn't find a position. I've tried everything, and now that I wear my brace at night, I can sleep.
Beautiful, beautiful. And Ellen, you're sort of the new person. You've only had the brace for a couple of weeks. What's your experience been in these last couple of weeks?
Well, I'm still getting used to the brace. I haven't driven in it yet, but when I have pain, I can't wait to put the brace on because I know it's going to relieve it. It's just so much better. And my curve was at least 70, and then when you fitted me with the brace, it went down to something like 30.
Yeah.
Wow.
So that was amazing.
Yeah. And you were diagnosed as an adult, right?
Yes, I might have had a slight curve as a young adult, but after I broke my femur and my right foot was shorter than my left, even though I put a lift on my shoe, it just got progressively worse.
Right.
Worse and worse, and I was in a lot of pain. And I went to a physiatrist who is a back doctor who does everything but surgery. He looked at my x-ray and he walked me to the office to make an appointment with the surgeon.
Mm.
He didn't even really say he could help me at all.
Right.
So I went on the internet and I found you, Dr. Strauss, and I am so grateful.
Beautiful.
Me too.
Beautiful. So it's very nice that we have both types of scoliosis represented. You have the adult with childhood scoliosis, and then you have Ellen with the what we call de novo or degenerative scoliosis, which usually starts at around menopause time, like a late 40s, early 50s, and that probably is what you're dealing with. But it's a progressive condition, and so now it got to the point where it's so severe. Yeah, so really we have three very large curves, right?
Yes.
Yeah.
You said 70,
75.
and you said 80,
81.
and you said
I think it
74.
was 70 something.
Yeah, I think so also. Yeah, so huge curves. And it just shows how even with a very large curve, surgery is a choice, but not necessity. And that's a very, very powerful thing for people today.